Saeju Jeong, welcome to the future of fitness.
Yes. Thanks for having me, Eric.
Yeah, it's a pleasure. And this is take two for everybody listening. So thank you for your patience, Saeju, as we work through Riverside issues. But I'm very fired up for this. As I was telling you pre-recording, I watched some of your interviews, read some of your stuff. And you just have a really great vibe. Very energetic. That. And as I was saying, with almost 18 years of foundership of a company like Noom, you still look relatively young, man. You seem to be keeping your health in good. I mean, I usually I'd see a lot more gray hair on people's trends. It's kind of like going through the presidency. So a lot to talk about with you. Noom's been around for a while. It's overnight success over 17 years, as they would say.
Oh yeah, of course.
But we have on the table we have GLP-1s, right? We have hyper personalization. We have what else we have? We have longevity. Like there's so many things to talk about, and these are all big buzzwords within the industry. But I'm going to kind of throw a curveball at you here first. So I was listening to a podcast you did with Jared Taylor and Layla Yari. Really good. I highly suggest people check it out. Slice of Healthcare. And it reminded me, I was at watching a band, and they did a cover of Led Zeppelin, which led to the inevitable conversation at our table about who's the best rock band ever. Now, I said Metallica.
Yeah.
And I want to get your thoughts. Like, how close am I to the mark in your opinion?
I love you, Eric. I think Metallica is incredibly strong and is an iconic band and artist. There are many good others too. It's just hard to compare, but the level of skill they had build the popularity around like in the heavy metal music to the broad music scene is admirable internationally. And I grew up with Metallica. So Eric, it's a dangerous topic that I can talk about Metallica for hours. But thank you. That's good stuff.
Yeah. And I know because and that kind of leads into a little bit of your backstory, because you were actually in the music business, right? Yes. Yeah. I love it. You were in the music business before you got into nutrition and tech and health. So give us
Still today, Eric, I'm very much into heavy metal music. I love music and art, and that is a very important spice of my life, But I figured my calling that I want to use my opportunity, and I dedicate my life for how to make sure that we build the community better and healthier, right? Mentally, physically. So our new mission, that's how we started, is we want to empower everyone everywhere to live a better, healthier life. Very simple, but powerful promise, the wish. And I say this to my wife, my mom, to you, Eric, to the community. That's what I do.
Yeah. Well, it's worthwhile. I mean, you look at accessibility for good coaching or even just information when it comes around the world of nutrition and health is really hard. Not everyone can afford a nutrition coach. Not everyone can afford a nice gym membership. I mean, there are very, very affordable options out there, but just not everybody can or will. So, making it easier. I mean, when you started Noom almost 17 years ago,
yes,
what was the original thought for starting? What's the original mission, and has that changed?
The mission. This is the part I want to tell you that how lucky and thankful I am, Eric. Okay. The mission has not been changed. And not because I think, luckily, that we figured the core problem that this world, the society has, and we need to pay attention how we can get better mentally, physically. So as a Korean, I'm Korean, by the way. I came to the United States in 2005. As an immigrant, that I think being an immigrant is very difficult to live, because I had to unlearn what I learned from South Korea, right? And I also had to learn everything new, the language and culture and the society. And the benefit being an immigrant is I can see the difference. And I have to tell you, I was very surprised and shocked how United healthcare system is complicated, and also the service is not better or actually worse than South Korea by the time. And it's still probably true, unfortunately. And that was a culture shock to me. Why? I had certain expectation about United States probably provide the best healthcare service, and also people should be healthy, but a lot of people were sick. And that gave me the opportunity to think why being sick and why is absurd cost is normal in this country, while it is the most powerful, most richest country and most educated country in the world, which is still today. So I was kind of like surprised that gap, and my entrepreneurial DNA triggered. I want to solve this, and I had a belief, Eric. I was naive because I was young and I was probably inexperienced entrepreneur by the time, but I think that sometimes help, especially for first-time founders. So I was naive, but I believe that if we apply the science and technology, okay, if we apply science and use technology to make it affordable and scalable, then we can change this. And that belief is still today the same. So Noom, we pay attention to millions of end users to make sure that we deliver healthy outcome by using science and using technology. We believe we have helped so many millions, and now that initial conviction and a belief has proven, and now we are double down to make sure that we do even greater job.
Oh, wonderful. So this is the first company that you founded?
Matter of fact, actually, I found a company when I was 19. Back to our original conversation, my friend.
Yeah.
Metal e-commerce music company in South Korea was my first company. And that gave me the taste of being an entrepreneur. And I absolutely loved every single day when I did that business. It was fun. It was a lot of fun.
Yeah. Awesome. Well, let's do this. Maybe you can explain Noom in its current iteration. Here we are in Q2 of 2024. Like, what is the customer experience like? Walk us through that now. I think that's always a good way to kind of start.
We have a two paths to become a customer. So either just the D2C business experience, which is when people discover us from like the App Store, as they have heard from their friends or they have seen our ads and they look for how to get better. And then they join our program. We provide a very in-depth the survey to learn about the oneself. We pay attention to the experience. Why now? Why they want to lose weight and why they want to build a healthy habit. We use a lot of psychology and CBT, cognitive behavior therapy, extremely important part of our service. And that's how it works for B2C service. And also B2B, our service has been well chosen by employer, and they distribute our service through benefit managers and the employee. At the end of the day, for us as client, they receive our service, and end users, they receive our service, and they have the same experience as much as the D2C service. So our approach is very unique in terms of how the digital healthcare service has been introduced, meaning we have a very strong strategy that we provide a hybrid approach to B2C and B2B. Why are we doing that? Because we believe the end user experience matters. I will not name a single company, but there are so many companies out there that is developed for the B2B client, solely developed for B2B client, and B2B client took the service for their employee to improve their health, and they distribute on behalf of the company. The thing is, because there are multiple stakeholders to satisfy, often the service is not completely focused to deliver health the best product experience. Because of that, the products are quite clunky and not good enough. So that's the kind of question mark we had from day one. And we pay attention. We want to make sure that end user experience is good. Once we have that, then we have a right to enter the B2B business, that we can talk to their the manager, the benefit manager or healthcare managers. That way we can discuss the bigger volume to handle the end user's experience. That's the way our strategy has been set, and we've been growing very well compared to the other traditional digital healthcare company, either you are in B2C or B2B.
I want to get your thoughts on the psychology of behavior change. I mean, that, is ultimately, as an industry, when I look at the fitness and in the coaching industry, let's put it that way, it really, we're in the business of behavior change. And when I was playing around about 5 years ago, I think with Noom platform, one of the things that struck me was like, the onboarding quiz or whatever you want to call it, like the series of questions, right?
Yep.
There was a lot. There's a lot of questions, right?
Yep.
But when I was breaking it down with a colleague of mine, I'm like, this is interesting. It seemed like you were getting people to kind of baby step them towards a commitment to engage in a program.
You can
like
say
little
that.
Questions, right? Easy steps. But as
Yep.
you get farther into something like that, if you're like 20 questions into a 30-question survey, you're probably already kind of committed emotionally. So maybe walk us through some of the principles of the psychologies of behavior change that you guys have discovered over the years.
Absolutely, Eric. That's a good question. The reason why psychology matters, because the way we discovered about using psychology it took many years for us, Eric. Allow me to remind you our history. So we found the company in 2008, and since then we built several products. Believe it or not, that our first prototype product was hardware devices like Peloton bike. I know. And then we tried to develop a service that is for Peloton-like. Actually, it's really like Peloton-like bike that is designed for a gym. And we learned it's very difficult to penetrate the gym market by then, 2008, 9, 10. Then we pivot a few times to become software company. And then we debuted the applications, which brought our first luck that we can raise the capital and bring the great talents, because we became world #1 most downloaded and used fitness product in the market. First product was fitness tracker. The reason I'm telling you this, let me move forward fast. So we did the fitness first, and then we learned about we need to also pay attention to nutrition in order to deliver our company mission. Remember that we want to deliver, empower everyone everywhere to live a better and healthier life. That takes a lot of effort. I remember, wow, in order to deliver our promise, company mission, we got to develop everywhere, like nutrition, sleep, stress management, fitness, all that, and a holistic service approach. Because by the time 2011, 12, we were already known fitness and maker. We were already quite renowned company. We raised a capital from Kleiner Perkins, which was given by the time was one of the best investor in the Silicon Valley, because we were pretty good app developer, right, Eric? But we knew what we have developed was a very well-made, strong feature. Do you understand what I'm saying? I'm sure, Eric, in your phone, you may have some very well-made application, but it's kind of feature. You don't use it all the time. It's a specific feature that you need to use it only when you need it, right? But in order to deliver healthy outcome, we need to approach holistic way. And so we pivot from fitness to calorie counting, and then we try to provide the coaching service, and we realize, wow, psychology matters. So we initially had the interview with psychology, the doctor, to learn his perspective and insight. And then he goes, wait, you guys built a lot of technology, and we have an access to end users through mobile platform, which is easy to access. And we have a lot of data. That means, he said, in our world, in academia, right, in psychology, there are so many practice that we can do better if we know something and if it's easy to access to end users. So we had that. And second, because we have a mobile platform, we can access to millions right away. We already had 1 million users, by the way, right? Several million users. The scale was different. Scale was not even comparable to the clinics. And that gave me wow, there's a great opportunity. If we apply psychology, then we could do a better job. Then now, and I apologize that I gave a lot of long history, but let me answer now your question. Why psychology matters? Because it's not about people are seeking for only information on how to get better. There's a deeper reason we discovered that people cannot build a healthy habit because they already built unhealthy habit, most likely, or they have a deeper reason they cannot change their behavior. Let me tell you something very interesting, Eric. Around 5 years ago, right? But not 5 or 6 years ago from today, 2024, when we pitched to investors that we are using psychology to change behavior, right? these behavior changing words were very rare words that the people speak about. Do you see? So when I pitch to investors, the money guy, they go, what? What are you building? Prevention service? That's already wrong. First of all, in healthcare prevention, there's no money. That's number one. Number two, what? Behavior change? What do you mean behavior change? What behavior you want to change? So why you want to change the behavior for weight loss? Kind of like, it was, believe me, Eric, it was very hard. Believe me, I wish CDC at some point, the CDC, the Center of Disease Control, right? I want CDC at some point realized that Noom provides so much effort to educate this world that behavior change is so important. We should receive some reward out of it. This reward, because we put so much marketing and also promote the world that behavior change first, and it was so powerful. And we actually learned from our psychologists, and they said, Saeju, a lot of people who struggle with the weight, there's a deeper reason, often related to like self-esteem. They got lost, or they have some stress issues. They couldn't get a good sleep because of the stress. All that is connected. And that gave us the clue that, wow, we must build a holistic service, not only just counting calories, not at all. How we can connect is all the pillars, right? We have now 5 pillars. Start with the diet, nutrition, right? And second, fitness activities. And third, stress, anxiety management. And fourth, sleep, which is resting. And fifth is community, right? The relations. So these are all very important pillars that consist of your well-being, right? If you didn't, I mean, you're the expert, Eric, so I gotta be careful, but you know this. If the oneself did not get a good sleep, then obviously the stress increase, and then the cortisol, the hormone is rising, then you will likely crave for greasy or salty and sweet food, which is against your healthy habits, all that. And you will be cranky mode, right? So your relationship will get impacted. We want to make sure that we are not a robot. So we want to make sure that using psychology, we can peel off one by one and understand a deeper reason why you have not built a healthy habit, but it's okay. Noom is not judgmental. We approach very healthy and organic way, and we are safe. We learn where you are at today, what's your goal, and why now. So that's why we use the psychology. It's extremely important for us. My last word is, for this question, people were kind of shocked how long our survey was in the beginning. Before even, if anyone want to use our service, they have to finish like 20-minute, sometimes 30-minute like survey. And that was kind of completely against to all the trends by the time. Now it became a trend because of Noom, to be honest, in our sector, right? But by the time when we launched service, every application were like kind of competing how to make it easy to start. Like we only ask 1 question, 2 questions, 3 click, and you're done. That was the beauty of a UX. But our service was, we wanted to actually target for those who are ready to commit and invest their time and effort in order to adopt a healthy habit. So that's why we intentionally add questions that is customized, and we had to ask questions. And the long survey automatically also filter out for those who are not ready to commit. So that's how that's why we had a very long, survey, and that it became our signature.
Yeah, it's really important, and I understand that investors may not get it as far as behavior change, or anyone who's but anyone who's been in this industry in the trenches, coaching, training, operating gyms will tell you that behavior change is critical. And it took me a very long time, Saeju, to kind of figure it out, that when people were coming into my gym to work with me or work with the staff, I stopped trying to sell them about 5 years into gym ownership. And instead, I kind of changed my mindset that I was interviewing them for the opportunity to help them achieve their health outcomes, their goals, right? And that's when it changes. The questioning, like it was a lot of questions, like how committed are you? Okay, if you're not at 8 out of 10, then why not, right? And it just takes a while, but it is hard. And we're just the world is kind of wired against us at this point too for nutrition and food, and it's not really an even playing field anymore. And this behavior change thing, this brings up the next big thing is like you guys are getting into medical weight loss. I mean, that's been a lot of headlines this Q1 so far. And I mean, when you look at the world of, and we could talk about the mass opportunity, but when it comes to behavior change, how and medical weight loss like GLP-1 and semaglutide specifically, how optimistic are you that they could turn the tide?
I'm very optimistic about this. Why? Because you may recall that when we found the company, the approach was using science and technology to deliver our promise, how we can help the society become better and healthier, right? And from that perspective, scientific approach, that the GLP-1 semaglutide product is quite proven. It is safe, and also there's a lot of the result came out from rigorous study over decade. Matter of fact, Eric, we are the first official behavior change companion service for Novo Nordisk in 2018, end of 2018, when they launched the first generation GLP-1 product, the Saxenda. So we have a history of understanding how this drug can actually work well for the weight loss, of the sustainable and healthy weight loss outcome. We have some experience. We work with them, and we have seen it, how the patient received it. The way we view our approach is very simple. Again, it has to be scientific. It has to be a sustainable, healthy outcome, right? And we understand a lot of patients struggle with their biological barrier. And GLP-1 can assist. They can lower the hurdle. But I want to highlight one more thing. What did we spend on most of the time today, Eric? Behavior change is must. And what is the FDA like the rule? The GLP-1 drugs there, like the label says must comes with a behavior change. I think that is a very important message today. That using this new method, pairing with the GLP-1 is a good support, is a great support to lower the biological barrier. Yes, and I support it. But without adopting healthier behavior while they receive the treatment, GLP-1, the medically assisted weight loss treatment, then I think we all know there's no shortcut to achieve a long-term, sustainable, healthy outcome. We all know it, and there are studies came out, and it will come out more, that people who just take the GLP-1 and lost weight, but they stop using it, they regain the weight quite quickly, but we actually worsen it by regaining weight, but more fat ratio compared to where they came. Because often losing weight is consists of the muscle and the fat, but around 40% of the body weight loss over medically assisted weight loss is contributed by the muscle.
Yeah.
And Eric, you know this better than anyone. Building a muscle is hard, especially for like senior. It's very hard. I mean, that's why we need to talk about nutrition intake, the protein intake, all that. But losing muscle, unfortunately, is fast and easier. Now, again, without the proper behavior change, but take this very powerful drug. It's very powerful. You know it. It's a very powerful GLP-1 drug. Without changing behavior, it's not going to deliver a healthy outcome. So we believe, like Noom received a great opportunity because we wanted to use our experience and platform to provide the best digital, the companion service for GLP-1. At the same time, I think there's a lot of understanding these days as GLP-1 shook the market last year. And remember last year, April, May, there's a ton of media coverage. Every single day there was a GLP-1. by big major media. And people talk about, what is that? I heard about the weight loss drug, blah, blah, blah. Now, 2024, people understand. And probably it's not too hard to find someone who received a benefit. Now, there's also, I think that's my first wave. The way I say it, that's my first wave. People receive that, they understand, and here to stay. Here to stay, okay? But now people are speaking about, people are not going to take this drug forever. Then what should you do? And people also claim that I don't look great. I need to do something. Yep, you need to eat right. You need to put some effort to make sure that you don't lose the muscle. That way you can have a truly healthy lifestyle. So that's the kind of TLDR.
Yeah, I love it. I'm very bullish on GLP-1. I mean, I've talked about this with a lot of my colleagues and friends and the events I've attended this year. There's kind of the traditional fitness folk who are more like, hey, there's no shortcuts. You got to do it the hard way. And I'm just in the other camp. I think it's a huge opportunity. And when you look at the, like big question for most people, well, how's a technology company offering support to GLP-1 users, and how are you guys changing the traditional consumer experience and support to now specifically people who are using GLP-1s? How's that different?
Yeah, I believe the benefit of using technology is in the first, using technology to make it affordable service, as you addressed very well, Eric. Like, we can make it easy to access the service. And second, scalability. So we can create the platform that we can reach to many more and everywhere. So it's not only the service to target for city, right? Who live in the city. So let me give you an example for our case, Noom. So we are able to provide thousands of the high quality, the fitness, the programs, right? So we want to make sure that our users can access to highly well curated, targeted for medically assisted weight loss drug while they're using those the treatment, how they can either defend their current muscle or how they can build more muscle while they receive this treatment. Does that make sense to you? So we have a customized program that is well created without any tools. You can do it at your home, right? And ease of access through your mobile platform, either tablet or mobile cell phone. We provide the programs that is already curated for this time, the GLP-1 time, okay? And second, there's also side effect, known side effect. We understand, because it's such a powerful drug, it also comes with side effect. And if it's known side effect, then well-guided side effect management is important. That way, the patient can receive the benefits, and we can do that. Third, you can speak to the doctor out of your fingertip because we use telehealth and telemedicine service technology. I think that's a beauty. So again, so people who have a hard time to travel or access to the right doctors, we can connect right away out of fingertip because using the beauty of technology, right? Telehealth, so we can connect like a board-certified obesity, the practitioner or practitioner advised the nurse practitioner. We can connect right away at the lowest cost. And I'm very proud of the platform service that we can do that, so we can help the patient quicker and cheaper. And I think that's a very, very powerful. And I'm also very bullish about this trend because, again, people struggle to manage the weight. And because of that, they are exposed to chronic conditions. They have a chance to reverse that. And as I mentioned, they can lower, this GLP-1 can actually lower the biological barrier. So it's a good opportunity they can re-engage and try it while they adopt a healthy habit.
And Saeju, how's it going so far? Like, what are you guys seeing? I mean, are you seeing a level of success for your clients? Like, are you more excited after 3 months now of however long you guys have been doing this about it, or are you kind of running into things that you're like, whoa, I didn't see that coming? Like, how's it going?
It's going very well. Why am I saying that? Because it's not we ask, it's being asked by our client. Either B2C users for sure, or B2B client, they are asking first about. So for instance, B2B clients, employers and payers, they're asking, how should we handle this like influx, the strong demand, right? So Eric, we are talking about platform level, okay? In healthcare, there's like a big players and pharma payers and providers. They 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 optimize the way they work. Okay, and this GLP-1, because it's so powerful and it's also kept so much attention from every individual families and also companies, because it directly impacts their current life and also impact their cost of the healthcare cost. So the question is loud and clear and bold. And I believe the technology company like Noom has a great opportunity, not once, not every year, not once in like every 2 years, I think once in like maybe a decade, the opportunity that how it can provide a scalable, durable platform that is pluggable to current healthcare system, at the same time deliver healthy, good outcome, what the GLP-1 is supposed to be used, and also what people, end users, patients, customer, you name it, what they want to have. And I think this is a great opportunity. So the answer is yes, it is going well, and the expectation is very high, as this is demand-driven market. Make sense to you, sir?
Yes, it does. I know you're not a doctor, but you're not a doctor, right? Are you a doctor?
I am not, but I'm surrounded by many, many doctors from Jeong family, my family, our office, our company, all that. And I think I spend way too much time on thinking about these matters all the time. Anyway, what's your question, sir?
I bet. Yeah. Is there anything that, you kind of mentioned, muscle loss, but is there anything kind of scares you about GLP-1 a little bit? Anything gives you pause about the possible repercussions down the road?
Yeah, I actually do have. I told my friend, because I observed my close friend has been losing weight by just literally using GLP-1 only. And I saw how he got lost weight, but I don't think he lost weight in a healthy way. I can tell. And I tell him, like, you gotta, what do you do other than just you put the needle into your body? And that's it, Saeju. And I asked him, when will you stop? Probably none. Okay. And I tell my friend, he's quite rich. I think that's why he doesn't mind to pay out of pocket all the time. I tell him that, why don't you build a healthy habit? So you can also manage this. Find a better balance. So that way you kill your appetite by having a drug, but you receive now the hurdle has been lower than ever, right? And yes, why don't you start build a healthy habit, including you pay attention to what you intake, and also understand the balance of nutrition, right? And that way you can also add muscle and make sure you are sustainable and you are self-dependent, independent. You can become you can take yourself to first, rather depend to certain drugs or some external support. Don't you want that? To unlock your best version of yourself by putting the effort, simply changing behavior. This miracle drug gave you the opportunity. It is an easier game than before. Then why not put some effort? And that is a topic that I am very passionate. I want to make sure that Noom provides a great service for our users. At the same time, I hope, when I mentioned first wave was like shockingly last year, oh my God, like a lot of people lose weight, the celebrity lose weight, blah, blah, blah. That's good. But what's next? Is that sustainable? And question mark. I think the price will be adjusted. I think the supply issue will be adjusted over time. But I want to make sure that Noom should receive the opportunity, should be the best platform. And I hope the behavior change part is become equally important and people are aware, so they put the effort. Okay? And that's the hope, and I believe there will be. Because otherwise, I don't think it is sustainable. The current price and the way it works, I don't think it's sustainable. So we need to figure the sustainable way, which is, again, behavior change must come together.
And great answer. I agree. Is there anybody else out there? I'm sure you're paying attention because it's kind of your job. But when you look at the market overall, is there anybody else that you think is doing, I'm going to use your terminology, GLP-1 companion service as well?
Yep.
Like, and it could be a brick and mortar gym, health club. It could be, standalone other tech companies. Like who else do you think is doing a good job?
Eric, I do believe I have seen many. And we we communicate with those people. Like there are a lot of good-minded and professional, highly well educated, like the doctors, providers, and trainers are already doing it. Nutritionists that are doing it, as you mentioned, brick and mortar, and I'm rooting for them. It's amazing. What Noom is trying to do is not compete with them. We are trying, we believe we will. Our platform is scalable using the technology, the beauty of technology, using the technology such as mobile platform, my friend, telehealth, okay, telemedicine, and then we are managing millions of users every day, and this volume give us an opportunity. We can lower the cost and deliver a better algorithm to make sure that we can deliver more customized, personalized, and have a better success rate to deliver healthy outcome. That's what we do. But we get inspiration. We work with them, the individual, the providers, the nutritionists, and fitness coaches. Your question is, who else than Noom is doing well in tech platform, I would say. I think there are many companies that are trying to do that well these days. And they claim they also provide a behavior change as a part of the component and as a service. And I think that's a very good move. I don't think it's a fair 2024 now that who is doing the best. I'm afraid to answer that because it's still new. We're trying to figure. But where I feel like we have a confidence that Noom will become the main platform for GLP-1 companion service, because we've been doing this it's our bread and butter. We've been doing this since 2012. And as I gave you a little history of our background company, since 2008, we developed several product lines from fitness to calorie counting product, all that. And the way we discovered the holistic way to a holistic approach to our end users and build using psychology was the result of our grinding of years of work that we discovered. And since then, we put all the best effort to make sure we are the best behavior changing platform, and we are the best. So we are applying our own know-how and experience. Over millions of users have gone through our platform, and we are now using telehealth and telehealth service to provide the GLP-1 service in order to lower their biological barrier. That's it. So I would say Noom platform is more organic growth from there, where we came from. And it is the mastery that we've been putting all the best effort, and Noom is known by many people. It's the best behavior change platform for losing weight.
And is there going forward into this year and next few years, do you guys have a partnership strategy? Are you looking to partner with other people, other companies and brands within the fitness space?
Absolutely, sir. Absolutely. So the reason why we do partnership, because this is the part that I learned in a very difficult way, but I'm telling our people that we don't want to reinvent the wheel, especially technology. We don't want to reinvent the wheel. If there is a great service out there, then we can work together with partnership. And also there are areas such as like a fitness gym, like we don't have expertise and we don't want to, again, reinvent the wheel. There are great gym locations out there, retail businesses. We want to set a partnership so we can provide our service with the known player there. We also work with a food manufacturer that is targeted for medically assisted weight loss patient and client who needs to pay attention to the protein intake. So we do the partner that way. We also work with the fitness content makers such as FitOn is a company that we embrace their highly well curated contents. We co-create how we can laser target, prepare the contents for medically assisted weight loss users. That way we can defense the muscle loss, and we provide the create program. Those partnerships work very well, and we will continue to look for like hardware devices, wearable devices are going to be partners with Oura Ring. We are launching the wearable like devices such as again the weight scale like that is. So again, partnership works, especially B2B world. We want you to learn. If Noom platform can benefits, then we should talk.
Awesome. And maybe give me you mentioned it throughout the interview here, but give us an idea as of Q2 24, like How is Noom doing overall? Like, what scale are you guys at? Share whatever kind of metrics you
Sure
feel comfortable
thing.
sharing.
We are private company, private health company, so we don't provide the financial publicly. But what I can brag about us that we are the largest consumer-led healthcare company in the United States. We among the digital healthcare companies in the market right now, 2024, a lot of companies are unprofitable, but we are quite solid. We are profitable. We have mature business model. I'm very proud of that. In terms of the paid subscription healthcare service, I think we are one of the largest company in the market. So, and what I can tell you for sure, behavior changing approach that keyword, then we are the largest platform, and I'm very proud of that.
Awesome. And can people, the consumer, uh, can they get reimbursements for the cost of Noom, like FSA, HSA, or even just straight healthcare reimbursement? Like, is that possible now?
That's possible, not nationwide, but that's the path, Eric. So some the payers they do. So we connect that the seamless experience to reimburse the service of Noom service, but not nationwide. But that's the path, and I believe it's a matter of time, but we will get there. So Noom service should be reimbursed by the payers and even Medicare. So that's the kind of path that we are developing at this moment.
Yeah, awesome.
Mhm.
I'm going to zoom out a little bit, and I want to get you to dust off your crystal ball here, Seju. Like, when you say 10 years from now, because technology is advancing so quickly, but when you look at the future of personalized coaching, personalized nutrition, those particular space, the space that you're in, like, how do you think, if you had to guess, how do you think that's going to look 10 years from now with the way that technology is advancing, artificial intelligence, like AR, like all kinds of different things are happening really fast. So, if you just had to predict, what would that look like?
I don't think it will take even 10 years, my friend Eric. I think
Okay.
my prediction is there will be more common service that is AI and all the latest technology enabled, assisted concierge for every individual. That's my prediction. Meaning, so far, probably like the rich, the powerful people, celebrity receive that service. Like that, if you're rich and an important person, then you may have like nutritionists, fitness trainer, right? And also mental support like psychologists, all that. Team of the staff is following you to support to make sure you're the best version of you every single day, correct?
Mhm.
That kind of concept will be more accessible and it's not too far from today, in my honest area, due to AI, Gen AI is disrupting the market. The cost is breaking down so quickly. And also, we talk about today the GLP-1 semaglutide, that price will come down. And also, I think the current version is needle, but it's going to be more, the tablet version will arrive. And also, it might be a liquid version in the future. So there's a lot of ways that people can manage the weight with this kind of evolution of GLP-1 in the future. And then lastly, the lifestyle. The look at us, we live in the world that we are is constantly inspired by like TikTok, Instagram, social media, and also world is connected because we are connected compared to like before internet era. Now, every like little the news in opposite of where we live right now, we can access and it become a news. So people will receive the latest scientific science and also technology news, and because of the developed Gen AI assisted technology disruption, the cost of accessing the latest technology to get me healthier is going to be very cheap, and people will seek for that. And Eric, you do know this, by the way, younger generation. I think you and I we are young, but even younger than us, like they really they pay attention to their own health about look, let's be honest about it, and also
Mhm.
and then also inner self, they pay attention to they pay probably I can surely tell you they pay attention to their mental health care far better than our generation.
Oh, yeah.
I think that's a good positive move. They pay attention to the core value of their life. And I think that will also dictate the way of the people, next generation will choose their lifestyle. The lifestyle. For us, my generation, Eric, like go to spa, getting a massage, doing a regular exercise every day, meeting nutritionists. It's kind of like for those who are retired with a lot of money. I'm being very honest, Eric. Okay? That kind of ideas, kind of, oh yeah, this person worked so hard entire life, sacrificed for family, blah, blah, blah. Now retired. So they're now finally putting effort to their own skin and what they eat and exercise, all that. Do you see? What I see in the forecast, that's happening now, actually already happening for our teenagers and 20s. Because it's doable, and also accessible and affordable. What do I expect in 10 years? It will become almost like accessible, and people do that. They seek for how to get healthy. When I say healthy, kind of high performance. They want to perform. They don't want to get aged. They want to mentally stronger than like probably our generation. At the same time, they want to look better. And I think that's kind of like a very healthy, trendy, more self-focused care, concierge service that usually limited to rich people now will become like very common. And due to technology development of like software and Gen AI and also hardware devices, I bet glucose monitoring device, non-invasive way will happen for sure.
Yeah.
And that will also open our eyes. Oh my God, now I know I have a sugar crash. Yes, you do, because your insulin level spike, period. And people will know once they have like a super sugary food or like, the juice, they will know. The current time we are blind. And I think that generation will look back where we live now, 2024. Oh my God, that old generation, they can eat like the shit. Pardon my language, but kind of like, they did not know about it. They just they just keep drinking the sugar all the time. Yes, our old generation, we did it. The younger generation, they will not do it.
Yeah.
Sorry, a lot of words that I had. Sorry.
I love it. It's great, and I think it's all probably pretty likely to come true.
Yes.
Last question I ask on the show. Obviously, there's a lot of things that we get to cover that I wanted to today. Saeju, so I'm going to have to ask you to come back on at some point. But what is one of the biggest challenges that you're facing right now as CEO and founder of Noom? And I ask that in the spirit of collaboration, like people are listening, they have a solution, or if you want to hear from someone, like what kind of keeps you up at night right now, and how can people help you?
So we are trying to build like a beyond weight loss service, Eric. And that was the beginning of that's how we found the company. That's how we evolved the company. That's how we developed a holistic approach service, right, Eric? But the perception of our weight loss is so strong. Weight loss. People want to lose weight. But if you use Noom service, Eric, funny enough that if we re-educate about the weight loss. It's not a final destination is about weight loss. It's about how we can guide you to build a healthy habit. Then, if you build a healthy habit, weight management, yes, it's happening. So we are where we are. That what brought us the success is our approach. New approach was very modern and different, using psychology and technology, mobile technology, all that. So people appreciate it. Now with the GLP-1, the dynamic of weight loss treatment has been massively changed, and yet people don't fully understand Noom's approach now about this weight loss. We're trying to build a healthy habit, and part of the service that we can also intake the GLP-1. So that the narrative change may take some time. As our generation also receive, what is this GLP-1? What is this weight loss drug? What should I do? I get that. So I think this is a good change, and it's an opportunity for us to restate where we are, and that's what we are putting good effort to make sure that Noom evolve rightfully.
Awesome. Saeju, if people want to get a hold of you or get in touch with your team or just general outreach after listening to this, what's the place that you'd like them to go?
We have an enterprise contact. We also look out our LinkedIn message all the time.
Cool. Fair enough. Well, it's been an absolute pleasure. Saeju. And like I said, it's there's many things we didn't even get into really. I mean, we touched on hyper personalization. We didn't really get into longevity too much, but there was way more to uncover here. So once again, if you're up for it, about a year or so, I'd love to have you back on. And yeah, it's been a lot of fun.
My sincere pleasure. Let's do that, Eric, because I'm curious where we'll be at in a year, actually in 6 months, in a year. So let's do that if that is a problem for you guys. And it's my pleasure to meet you who have full understanding of the longevity and fitness and also overall well-being. It's always nice to see other experts. Thanks for having me today.
Yeah, my pleasure. Ladies and gentlemen, Saeju Jeong.
Cheers.